So this session, as I've just mentioned, looks at opportunity within the therapy market. Like so many sectors, the therapy sector really had to change very quickly to adapt to the new world that we found ourselves in back in March. So it's been very interesting to briefly chat to Mike and Malcolm before this session, and really excited to kind of delve in more to the changes that the therapy sector has had to kind of deal with and overcome over the last few months. Similar to last week, we talk about opportunities in this conversation. Of course, that does not take away from the severity of the situation and how it's changed many people's lives and businesses. But we are in it, we've had to deal with it, and as a result of that, there's been some really positive outcomes for the market, and it'll be interesting to see how they will impact as the sector develops and continues for the rest of the year and into next year. So I'm going to pass over to Mike first of all, and then to Malcolm to introduce yourselves, your background, what you guys do now, and how it's been for you for the last 4 months.
Thanks, Lucy. Hi, everyone. My name is Mike James. I'm one of the directors of Sports Injury Fix. I'm quite old, so my background takes a while to get through, but originally I grew up and spent the early part of my career in the fitness sector as a personal trainer and working in gyms before evolving into a career in the Royal Air Force as a physical training instructor and then an exercise rehab instructor. Along the way, I picked up some sort of academic roles within the therapy world. And eventually, after leaving there, after the best part of 17 years, I did my Physio Masters and started practicing in the private and the public sector. So I've got a bit of a diverse background over the last 20 years, working still in the fitness world, but predominantly now in the therapy world. And I try to practice when I'm clinically practicing as some sort of in-between hybrid fitness instructor, exercise specialist, and therapist. I still practice clinically. I've got a business that specializes working with endurance athletes. And a few years ago, I was kindly invited by the man below me, I don't know where you guys can see him, to become a director and the sort of therapist face of Sports Injury Fix. So my full-time job now is as a director of Sports Injury Fix, and I still practice clinically then in the evenings and the weekends. The last 4 months for me as a clinician hasn't been affected too badly because it's been such a small percentage of my normal working week. I do miss going places and teaching people things, but we found new ways around that. But as a business for Sports Injury Fix, which I'll leave Malcolm delve a bit more into, we've had a roller coaster 4 months, which has provided us actually a hell of a lot of opportunities as a business ourselves, but as a service for our members.
Yeah. Thanks, Mike. So I'm a little bit younger than Mike, but not by much, actually. So equally, a bit long in the tooth. So from my side, I've come at it purely just, for once, people can actually see me when I say this now, actually. But yeah, scrawny bloke, made of glass, just constantly broken myself over the years. I've lived all over. Football, running, triathlon, you name it. I've tried to do it, sometimes succeeded, sometimes failed. But I always got really frustrated at why is this whole industry just not joined up? You know, for starters, if I'm injured, I'm then asked to make a decision whether I see a physio or a chiro or a sports therapist, a sports rehab or a soft tissue therapist. But this goes on. No idea the differences. Don't really care, to be honest. I want to get back running and I've hurt my knees. So who specializes in that and who can best help me? So I started out with trying to solve that conundrum and just make it simpler for the average layperson, as well as then starting to break down these silos. If there are all these individual competitive silos, or actually, why can't personal trainers and S&C coaches and exercise instructors work alongside therapists or be therapists themselves? Why are there all these politics? Because the only person it's harming is the person on the street that wants to get fit and healthy and stay fit and healthy. So it's all frustrating. So my background is very much from a business side. It's been 20 years of problem solving and strategy and doing a lot of stuff actually with risk and very much at the sharp end of policing and defense and security side of things. But actually then coming in, it was bringing some of that awareness and understanding, and did a lot of having to break down barriers and politics and get people to focus on what the actual problem is, rather than what they thought their immediate facing problem was. And so then that was very much a meeting of minds with Mike, and also then with our tech director, a guy called James Edgeworth. And we said, right, okay, let's start trying to solve some of these problems. And actually what that led to is it was baby steps, and it was just a part-time thing that started off, that actually more and more industry association chairmen were saying, well, this is brilliant. It's a breath of fresh air in the industry. This is where we need to go. You're empowering therapists. You're breaking down barriers. You're breaking down this exercise and rehab professional divide and physio and non-physio divide. And that's a really positive thing. And you're making it simple for individual or small numbers of personal trainers and therapists to use technology to empower them to help more people and to make their lives easier. So that's where Sports Injury Fix has evolved, and thankfully seems to be doing very well. In terms of how COVID has affected us, it's something that I'm actually very proud actually of how we responded, because it was a time when everybody was having to cease trading. So everybody was going into hibernation, so to speak. So it would have been very easy for us just to say, cool, let's do the same thing. Let's furlough everybody and let's just shut down until people are reopening. But actually what we saw is, well, because we are part of the industry and we understand it, we know that the majority of personal trainers and therapists are self-employed. It's 1-2 person businesses. And that was really challenging. Actually, now is the time when they needed as much help as possible and guidance and reassurance. So actually, anybody that was using our platform, we proactively said, cool, you can pause. You don't need to pay us any money. We know you're not earning any money, so we don't want you to suffer along that side as well. And actually, not only will we let you pause, but actually let's help you understand what your options are. One of those options is around virtual consultations. So actually, here's a load of advice, of guidance, of freebies. What's the technology that's out there? What should you use? How are the patients thinking and feeling about this? What are the options that are there? Every Tom, Dick and Harry was rushing out video conferencing software. Is it secure? Is it worthwhile? Is it easy to use for the patients? So helping them with that side of things, with the choices there. But equally then, well, how do I adapt? How do I adapt what I offer online? And actually, one of Mike's strong suits is the fact that everything he's done has been online, actually, or the majority of it recently. So he's a real expert in that. So it was about sharing some of that, doing some sessions. I deliberately broke myself running as I normally do. So actually we could do some genuine sessions of, right, I've got a pain that I can't talk to Mike about face to face. Therefore, what can you do to help me? And how then after that can I be strengthened up to stop that problem reoccurring? That seemed to go down very well, and there was a huge appetite for it. What we found was interesting is it feels like it's helped separate in the industry those that really care about the industry and care about those 1-2 person businesses and want to help them, and those that have gone, well, it's just about money, so we're just going to shut up shop until we have the opportunity of making money. So what we're seeing now is that as everybody is reopening, those people that had taken the time to help people, then actually they are really reaping the rewards of it. And although the last 3-4 months, certainly for us, were a very painful time financially, and there were a few hard questions that we had to answer ourselves and decisions we had to make, then thankfully it feels like that's being rewarded now, because now we've got the trust of people. So actually when they're going, oh, how do I open back up? What are the options available to me? Then actually they feel like they trust us. They know that if we can't help them, we'll tell them how they can help themselves, what the free options are, what the paid options are, what alternatives are to us. And yeah, as a result, we are busier than we've ever been, to be honest.
So many great points within that, which we're going to go into a little bit more. One of the things you mentioned that Sport Injury Fix do, and it's something that obviously as Elevate as an event that's cross-sector, so we look at physical activity, but within that we look at health, therapy and performance, is breaking down those barriers between different people in the sector, different practitioners, the therapy market being connected to the fitness market, the health sector being connected back. And I think one of the opportunities that's come out of COVID is the importance of our physical activity and our health and our fitness has been really, really highlighted. And I think long term, that could be an interesting benefit for the fitness market. How are you finding that? Because lots of people have started running over the last 4 months. Some people I've seen have never run before, and naturally having some injuries there. How have you how have your clients predominantly seen things develop over that time as people start to get more active? You know, people are saying this is the most active we've been in the UK for a very, very long time. Never before have we been told every night by our politicians to go outside and exercise. So that's been, you know, a benefit. Just going back to Mike first, how have you found that from probably people needing to train up or to kind of help people through that?
Yeah, we've seen a similar, you know, the diversity between the fitness world and the therapy world is far smaller than many people think. So we have seen exactly the same trends. I think it's brilliant that we'll see this increased vigilance in people's awareness and appetite to maintain a healthy life. So you've seen sort of three things. Those who are active do even more. Those who are inactive do more. Or in some cases, active people just take a break and do less, but now start to want to increase again. And they think they can just jump back onto the levels they were once on without a graded approach. Now, in the therapy world, we obviously have two ways of approaching things. We can try and help fix people, or we can try and stop people getting injured in the first place. And the message that we've been pushing really hard to our members, but all therapists during lockdown is, whilst these activity rates are spiking or will continue to spike, don't feel you have to be reactive to this stuff. Start using the platforms you have at your disposal to be proactive. Educate the people, push out loads of content to do with trying to reduce injury risk. We don't have to sit back and only help people when they limp through the door. So we've seen many people starting to explore new avenues. Lots of people who weren't that sort of frequent or regular on social media. They didn't write blogs. They didn't send emails and communications with their members and their patients outside the realms of, if you're on my books and I'm treating you. So we've seen people really diversify the offerings that they give to the public, and that can only be a good thing.
Yeah. And actually
Malcolm, do you want to add to that?
Yeah, I think, you know, we talked at the start about opportunity. And it is one of those times where we had so many people bemoaning the fact that people weren't active before. As a PT, you'd see them and they wouldn't do any exercise until you saw them a week later, despite saying they wanted to, and then you'd get all the excuses. So then they wouldn't get the gains that they wanted, and then sometimes they'd blame you for not getting the gains they wanted, when actually it's about holding up that mirror. Exactly the same in the therapy world. You know, as everybody's seen, the therapy world is less about, I'll give you this rub and I'll click you into place and you're suddenly cured. Now it's all about movement. It's all about activity, and that's what really helps them. And again, it was bemoaning the fact that people weren't doing it. Now people have the bit between the teeth and are being active, which is great, and that's providing so much opportunity there for actual greater outcomes that weren't there before, because that mental shift wasn't there. As Mike has mentioned as well, it's one of those things that communication now is just really key. Those people that have stayed in contact with their clients are the ones that are reaping the benefits. If you haven't been able to stay in contact with clients because you've had to, for money perspective, go and, you know, work in your local Tesco or Asda or drive a delivery van, etc., and you've been doing long shifts and homeschooling or whatever, that's okay. You know, just understand what those shifts and changes in behaviors and attitudes are, and make sure you're engaging and communicating with your client base to understand that. Because again, we see what the general trends are. That won't necessarily be reflected in all of our client bases. Some of them will be a polar opposite shift to whatever's there, or at different ends of the spectrum. So it's probably now is more important than ever, as that opportunity of re-engaging with clients, understanding them, saying, right, let's help, let's understand, well, how has lockdown changed your views? Do you have different goals now? Do you approach things in a different way? Are you more active? Do you need some more help? It might be for some of those clients that actually used to see them once a month to tick over. Actually, now they want more accountability. They've got the bit between their teeth. They want to be seen every week or every few days. And from a therapy perspective, that sometimes creates an ethical question, because people are saying, well, is it right that I take their money when they could be doing it themselves? But actually, as long as you're having an honest conversation with people and saying, look, you can do this yourself, you do realize that, but the patient or client is saying, no, I want to, because I want that accountability, well, then that's okay. And at a time, actually, when everybody's trying to recoup some money, it can be that by opening those lines of communication, you're actually really increasing the numbers of times you see people and actually the money that you're earning from them. Because it's equally being aware that there are those that will still be really paranoid about things. There are still those that are shielding. There are still those that live with loved ones that are shielding. So we've certainly seen, of client bases coming back, there's a good 50% of that client base that will be incredibly nervous about coming back and won't.
Yeah, so that's something to touch on that is different in the therapy side than it is on the fitness side. Gyms were told to close their doors, I think it was the 20th of March. They're able to reopen this Sunday. But am I right in thinking physios and other practitioners were able to keep practicing? And I completely get not everyone will go and see a physio. In fact, I was talking to my brother-in-law at the weekend, and he said something about going to see his osteo when they reopened. I said, oh, I think they were allowed to stay open. But he was like, oh, I just assumed they wouldn't be. So a lot of people probably assumed that things wouldn't be open. So I guess my question is going to be kind of twofold. First of all, like, am I right in thinking they were able to stay open? And was there some confusion over what that meant? And who did everyone, not everyone, but like, did a lot of people stay open? And then other part of the question would be, how did people's way of seeing a therapist change? Did it become a more virtual option? I'm sure there's a lot to talk about on the virtual side. So yeah, Mike, what's been your experience on that side, and how was it on the therapy side? What could happen, what couldn't happen?
So it's been confusing on our side of the fence. Effectively, if you were something called an allied health professional, so a physiotherapist, an osteopath, or a chiropractor, then you could stay open to see emergency people or urgent appointments. And although they're not black and white guides, there are grey guides of what would classify and qualify as an urgent appointment. So that in itself caused debate within those three professions, whether they elected to stay open or whether they decided to close. And again, then what qualified to be seen. For all the non-allied health professionals, your sports therapists, your sports massage therapists, your sports rehabilitators, then they weren't able to stay open. But because they offered much of the same services that those other three professions do, then that created a lot of discussion and debate and arguments between, well, why can they and why can't we? Now, as thankfully we seem to be getting to the sort of openings of these clinics again, then for those first three mentioned professions, then yes, it's suddenly become a bit more clear. Most of them are starting to open their doors. Again, it's left to it's guidance, not sort of dictated rules of what you would then deem appropriate to see. Effectively, if you put what you deem to be an appropriate measure in place based on those guidelines, then if you can justify still seeing people in whatever capacity, then you can move forward with your business. So you will see within, if you use your brother as an example, there will be osteopaths that have remained open. There are osteopaths that will have stayed shut. There are osteopaths that are now opening again, with one clinic deciding to see some of the population and others deciding not to see that same population. So it is quite independent that way, whereas obviously the fitness sector has been a little bit more black and white in what everyone can and can't do. We still have large areas of the therapy world remaining shut. And again, then just to complicate and make the waters even more muddy, we've got the devolved nations and the regional differences and how their governments are directing those. As far as the virtual side of it goes, then that was the option that most people have had from the outset and still remain to. I think what's always been interesting from me with it is there has been a large proportion of the therapy world have almost stumbled across virtual appointments as if it's something new that's come along because of COVID. Virtual appointments have been something that have been used worldwide for a long time. There are businesses out there who exclusively operate working on virtual appointments. Not everybody has been forced to do it. It's an option for people to take forward. And some people have just not bothered. Some people have said, because of the way I practice, I just can't get my head around operating this way. Some people have used it as a stopgap, a short-term measure, with the thought that as soon as I can go back to face-to-face, then I'll abandon that as an option. And I think it'll probably revolutionize some people's offerings going forward. Some people will use it as a large-scale part of their practice. Effectively, what it's done is it's created an option for therapists when everything is back to normal or we're in a long-term new normal. Therapists have an ability to have an offering. Now, you may be someone, so if you think of the traditional one where someone's running late and they ring the clinic and say, I'm not going to make it in. Normally it's a cancel and rearrange. But suddenly now you have an option of say, okay, let's save you the travel time coming in. Same situation when someone's saying, I'm a little bit under the weather, I can't come in, or my child's come home from school, so I'm going to have to cancel my appointment. Well, now potentially, if it's something that fits you and that patient, you could now say to them, look, I'm in the clinic, you're in the house, that's not the problem, let's do a virtual appointment. So I think it should be something that, although we'll have a spectrum of responses in the long term, it's certainly helped a lot of patients during coronavirus, but again, with varied responses and opinions on them. It's helped a lot of therapists through this time, and it should remain an opportunity for people to embrace in whatever capacity they want as we move forward.
Yeah, that's really interesting to hear, and I think that's it. It's an opportunity. It's another way of doing things, because not every and especially in the next few months, not everyone's going to feel comfortable going back. There will be people that shielding technically finishes in the next week or so, but there's still going to be people that are uncertain. Malcolm, what are your thoughts on that? What are your experiences? Anything else to add?
So I think it's just worth being really cognizant of that fact that a lot of people aren't yet comfortable going back. We've certainly seen it in some of the therapists that have reopened, or some of the clients that have reopened. And you talk to them and say, well, there was this, client-centered care, patient-centered approach, whatever the language is you want to use. How have you involved the patients in making them feel comfortable? And actually then the approach is normally, well, I've put emails out and I've told them what I'm doing. So they haven't been really included and consulted within that. And you say, well, how many people are seeing you and feeling comfortable? And invariably the answer seems to be 20, 30, 40% of clients. So what that indicates is there's that 50 to 60% of clients, maybe more, that still feel uncertain, unknown about it. If they're just being told things, well, they feel like they don't have a say. So it's how are you getting that voice and that understanding? And obviously that's a large chunk of client bases that we need to feel comfortable. So I think the ones that have done it really well and have been really successful are the ones that have found the way to include their client bases in it. So when they've done that reopening, they've been very sensitive to both sides of the market. So it's that approach of, look, if you want face-to-face and it feels like face-to-face is the most appropriate option, then we have done everything, they've done video walkthroughs, etc. Really helps them feel comfortable. And we all know that know, like, and trust are the three words that everybody wants. And if clients know, like, and trust you, they'll spend money with you. So if there's that reassurance that's there about when coming in, either to the gym or the rehab clinic, whatever it may be, then they feel comfortable. But equally, it's not, right, well, this is your only option now and there's nothing else. So then they're cognizant, well, it's no problem if you don't feel comfortable yet, because we do have these virtual options that are there and they can be just as good. And actually, it's about mixing and matching. And we know that, again, that those therapists that are and exercise professionals that are listening to their clients they're engaging with their clients, they have that two-way comms, then that just stands them in such good stead. Because it's easy to go, oh, I can reopen now. It's all about reopening. It's all about face-to-face. And actually with the buffer times and cleaning, that they go, oh, well, I feel like I'm busy and that's all right. But actually when they look at it, they've only engaged 30% of their existing client base. And actually what they haven't realized is they've alienated and lost 70% that's there. And as mentioned a bit before about if you engage with them correctly, there's so much opportunity there, because again, this is a time when there are so many people that are ignoring and forgetting about doing those basics of comms. And if you are the person or persons that are doing it in the right way that makes people feel comfortable, then you will win business from other people that aren't doing that.
Very interesting. You've both mentioned about communication and the changes in kind of how we want to be communicated with. I think this was very much a time where everyone's lives changed in some way in the last 4 months. Some people I know have actually really found it a very useful time. They've been able to work from home, see their kids more, not traveling all around London all the time, and probably quite enjoyed parts of it. And other people it's not been as nice. You know, it's been some quite devastating obviously things happen in this time. The changes in communication and how I think that's been really highlighted and how important that is. There's been a massive shift across the whole nation about supporting local and supporting smaller businesses. And I think that's probably been a really interesting time for the therapy market. I know it's definitely been an interesting time for the fitness market, supporting your local gym, etc. And I think that will be another part where people are wanting to support their therapists. So obviously sometimes very small companies or one-man bands and people kind of practicing from home or in a small business. So it has enabled people to continue to support if they feel they've needed it. But like you say, the communication has been really, really important. How have you helped people with those comms? I think it was a time where people's businesses did really well if they were able to stay human and engaging and, like you say, build that trust and that human interaction with people. A lot of companies just sending out blanket kind of emails and not necessarily having those conversations. I appreciate sometimes you've got to, you know, speak to lots of people. But yeah, how have you found that moving? And do you feel that has kind of weeded out some of those that weren't very personable and very human, and in something like therapy when you have to be very understanding, your one-on-one patient work, do you think there will be practitioners that decide not to practice anymore for various reasons? You know, I think we've definitely seen the standard within the fitness market. People had to step up to a mark in the times they were closed. Has that been a similar thing in therapy? Passing over to whoever wants to take it first, really.
Yeah, I think it has. What's been really interesting as a therapist is that even sort of the university, vocational, academic teachings of the last 10 to 15 years has heavily shifted focus onto communication skills. So we are probably pretty good at communicating in that clinical setting. When someone's in the clinic with you, on your treatment couch, in the gym with you, and you're chatting to them, most of us have got really good at that. It's the non-clinical communications. It's that business approach to it. It's often what we have not lacked in, but perhaps not had the awareness and attention of. Now, we've done it a couple of ways, and we've been lucky in some ways. So as a business, because we don't have a physical practice with patients coming through the door, we earn our money by helping our members with their businesses. So we were almost able to have a step back when everyone else's heads were on fire about having to close down and do everything else. Then we have to appreciate that some of them who would have thought with clarity a lot of the time were in unique situations where they weren't thinking with a clear and clarity of thinking. So what we were able to do was just step back and just signpost them a lot of the time to things that they would have normally been really good at doing, and realize that these basics are something you should continue to do. I think we did a pretty good job, and it's certainly when Malcolm alluded earlier about being proud of how we handled it. I'm a dad of 2 young boys, and my biggest message to those is I always tried to set an example for them. And whether consciously or unconsciously, we did a really good job, I think, as a company of communicating with our members. And therefore, when we were passing the messages on of how they should communicate with their members and their clients and their patients, then I think we set our stall out quite well that look what we've sort of done here and how you can do it. So I think we led by example to a degree. There's always going to be, as you say, that difference in ability to communicate with people. We have been able to show people different ways of communicating, whether that's to be more efficient and more streamlined, whether it's electronic communications or social media communications. But we've also been really key on not losing people's principles of good old-fashioned communication. If your patient needed a phone call, if you needed to, chat to them in ways that a lot of people now would not think of as first-line communications, then we've done a hard job of trying to keep expressing to people there are multiple ways of communicating. I think the fitness world's probably the same, but when a therapy or a therapist is open and they're busy, then it's often hard to find the time to change some of the things you do, even if you know it's something you need to. And certainly you often worry about, well, if I change the way I operate, how will my patients respond to that? And they've been forced into now having an opportunity to change and improve the ways they do and communicate things with their clients at probably a time where the world has never been more accepting of change as well. So we've been able to, I wouldn't even say handhold, but just signpost and navigate some of our members through different ways to expand their communications. I'm probably starting to waffle there, so I'm sure Mark's got something a bit more succinct to add on. I'll stop.
It's all right. I think there are two key points there. So just to build on what you've said. And one is that there's been a lot of pressure on people. Right, you've got to communicate. You've suddenly got to start doing video and put yourself out there and all this social media posts. And that scares a lot of people and they don't feel comfortable with it. And so that can take the time to either learn of doing it or actually just something they never want to do because it's not genuine. It's just not how they are. So some of it is that reassurance of there's lots of different ways to communicate. And as Mike said, different things work for different people. So for those that aren't great at doing videos, some of them they literally just telephone their clients because then it was friendly conversations and they got far more benefit from that than putting out a few awkward videos talking about, well, this is how you treat this certain thing or do this exercise. So it's about doing things genuinely. And it's equally those that then it provided an opportunity to pause and go, well, how can I be more effective in my communication? We know the whole industry has been paper-based, which often means that it's telephones. And when things are busy, you're not getting back to voicemails until 6 o'clock at night. So you can't get hold of people. So you're playing voicemail tennis. Equally, it's that, well, there's my diary and I've got it written down and I've got Sarah at 10 and Dave at 11 and can't really remember who they are. Whereas nowadays it's provided that opportunity, and particularly because we need to get rid of paper for obvious reasons with everything to do with COVID. It's, well, let's automate a lot of that comms. Well, if someone's booking with me, let's make it really simple so they can do that online. And then when they've got that booking, they get that nice welcome email that explains what to expect. It gives some of those forms, which then they have to complete. And again, it can all be done online. People can do it via Sports Injury Fix. Other platforms are available. That means that the client completes that information, feels like they've got their hand held right from the moment they're even deciding or considering whether to book. They complete that information. But what that means is then for yourself, rather than going, oh, well, I've got Dave followed by Sarah and I'm not quite sure who they are. You're like, right, well, I've got Dave at 10. He wants to achieve this. He's got this issue. Here's all the background. I need to do some pre-reading of that. Cool. So then when Dave walks in, rather than going, can you fill out this form? And I'll stand there and watch you for 10 minutes while you fill out that form. And then I have the context. Your customer success and your communication with them is just so much better. And it's a better experience all around. And likewise, one of the other points I think is super important to bear in mind is we talk about comms, and you talk, Lucy, about that shop local. Now, what's fascinating is there are those people that go, yes, I'm local, everybody should shop with me, you know, and they really ham that up. And we know that it's a good thing and it should. But then it's also holding up a mirror to yourselves and that behavior. Because then, well, one of the problems in the past was everybody viewed, you know, therapists would view personal trainers as competition, or other personal trainers as competition, or other therapists as competition. But actually what this has really taught is that collaboration beats competition hands down. If you're a sports therapist and there's another sports therapist working in a gym nearby or a few doors down even, the chances are that other sports therapist will have a different area of expertise to you. You'll still be able to all have that same skill set of being able to treat people, but there'll be their different areas of expertise. So actually, if you work together and where you have a client that's in that sweet spot of that expertise, and you work together and refer them, those clients, and vice versa when they know your area of expertise, well, actually that doubles your reach. That creates a better client experience. That leads to better outcomes. That leads to more business for both of you. Suddenly then worrying about what each other are doing and having that stress, then suddenly you've got this informal or formal, however you want to do it, collaboration that leads to great success. Likewise, we know there are therapists that hold on to personal training clients because they think, oh, well, I'm just strengthening them up so they won't get injured again. When actually they'd be far better placed passing that off to a trusted personal trainer. Likewise, we know there are personal trainers that have clients with injuries. Oh, and I'm just strengthening them up. Oh, they don't need therapy. It's all right. When actually, again, you know, you should have that virtual or physical network, informal or formal, where you can refer people on. And the people that have really thrived is in this time of lockdown and now moving forward are engaging with those local people they previously viewed as competition. They're starting to know each other. They realize they're people. They realize they've faced the same challenges. They're helping overcome those challenges together. They're collaborating. Not only is that making each of their own individual lives easier, it's making them more successful in business, and it's making the client experience and the client outcomes better as well.
Yeah, I completely agree. I definitely feel that the collaborative approach has definitely been heightened during COVID. People supporting each other, seeing each other as less as competition. Everyone, you know, everyone's in the same boat at the moment, maybe on slightly different seas at different times, but everyone's in the same situation. And I think it helped everyone become, like I said before, a bit more human, a bit more approachable, a bit more honest about what they're going through and the challenges they're facing, and helping each other out. You mentioned about moving away from paper and advancing on the more technical side of things and tech for the sector. Therapy, from my experience of dealing with it on the Elevate side, generally the brands are sometimes a little old school in some of their approaches. People attending sometimes are very much wanting in advance a paper floor plan and things like that. Do you think that COVID, like so many sectors, has really pushed therapy into a more tech-minded space? And what is that going to look like moving forward? I mean, it's great for the environment. It helps speed things up. It helps with keeping records electronically rather having stacks and stacks of paper for every single patient you've ever seen. How do you think that's going to help the sector grow? Because ultimately it should help it. Pass over to Mike.
Seeing as you just talked and described me perfectly, I'm going to hand over to Mark.
Yeah, actually, it's like, all jokes aside, one of the real benefits that we have is working with Mike, and Mike was very much a traditionalist in terms of pen and paper was his forte. So sometimes deliberately when we're developing things, we won't tell Mike about it, and we will literally go, right, Mike, can you go on the platform? We've done this, try it out. And actually, if Mike can do it, then it's that view of brilliant. That means probably 95% of therapists can do it. And that means it's simple. If he doesn't understand it, well, then it's not clear enough. And that's super helpful to have. But in terms of what's fascinating is if I had £1 for every single therapist or personal trainer we've had that's contacted us, particularly in the last 2-3 weeks, you know, with the, now they can or had the hope of reopening, and now have dates where they can reopen and they're getting prepped for it, of going, I've always known that I needed to move electronic, but I never have. I'm a tech dinosaur because I just want the hands-on aspect of treating or helping clients and patients. I'm not interested in the tech stuff. It doesn't float my boat. So I've always just done pen and paper because it's easy. Now I can't do that. So, well, what is this thing? I'm having to make the change. How can you make it simple and easy? And for a start, what's really apparent is actually there's a ton of options that are out there that are faceless, that are either free or they're based in Australia or New Zealand or something like that that people can't talk to. So then how can you have your hand held? You know, these are very personable people working in personable industries that want a personal touch. They want to talk through. And that helps them understand it and get the benefit. So it's interesting in terms of, I think it's forcing a lot of tech companies that didn't have a human approach to take a more human approach of going, let's help people understand it. Let's make them feel comfortable with the decisions. And understand how that helps their business. Then what's fascinating is, I would say 95%, maybe 97%, I think, of those that we've onboarded have gone, holy moly, like I didn't realize how much time this could save me. So you're telling me that it's all set up so somebody can see my availability, can book in with me. I get all of that information. They get all the automated reminders. They get an SMS. They've filled out all my appointment forms. They know what to expect. They've had this lovely human touch. They've not had to wait around and play voicemail tennis. I've got all the information so I can prep. And effectively, so then my day's just nicely there. All the information's to hand. If I'm in a clinic I didn't expect, or I go in last minute, all that information's there. Well, that's probably saved me so much, you know, at least an hour a day is what we find. And it's that thing of going, okay, well, at the moment when I've only got a couple of clients, I'm just reopening, well, that doesn't make too much difference. But when I start getting back as having 5, 6, 10 clients a day, well, wow, that's, you know, that's going to give me back a huge amount of time. I had no idea it was so easy. And they really make that transition and they jump. And likewise, those that have, you know, then been embracing technology and have been doing classes. And normally they've been having 5, 6 people at their face-to-face classes. Suddenly now they're having 12, 15 to 20 people on their virtual ones. So they're going, well, this is easier for me and I'm making more than 100% return in terms of the numbers. Wow, this is great. And again, I can set it all up so it's all automated. So I have none of that admin faff, because I always thought once you started getting 15, 20 people and they're constantly messaging you and asking all those questions, that it's a right pain. And now it's all simple. So I think what it's done is it's just opened people's eyes to the fact that, yes, there are options out there from a technology perspective that are frustrating to use, that are faceless, that don't understand your industry. But actually utilizing software, and this is where it's really come to the fore, of that understands your industry, then it really works. We know in this space of the exercise and therapy professionals, we know some of them have been using like freebie software designed for hairdressers. And it's great at simple booking stuff, but suddenly when you get into that patient notes and class bookings and client notes, it just doesn't do that. And they get really frustrated by it. And then some of them will be there going, but then if I have to pay a small amount of money a month, I don't want to pay that. But actually now, because of all the changes, it's forced them to look at software that's meant and tailored for their industry. And then they've gone, okay, you know, for example, our software, it's less than $10 a month. And they've gone, so it cost me less than $10 a month. And you're saving me at least an hour a day. And equally, because of the notifications, because of the payment functionality that's there, I'm getting less no-shows. And if no-shows happen, I've got their money as well. And I'm getting more clients on the back of it as well. Well, yeah, you know, the return on investment for that is unbelievable. Like, why wouldn't I do that? And it's amazing to see even the most ardent pen and paper people, you know, when the penny drops and they realize what that means for them, which is either if they're, you know, if they want growth, they can achieve growth and more money. If they just want more time with the kids, more time with the family, you know, less admin burden, it gives them that as well.
Yeah, I think the time and money thing has really come into play. People have really started to realise, those that haven't had their commute during this time, or everyone's schedules changed quite a lot, and then people start realising what they're doing with their time. One quick question: digital and virtual assessments and consultants and things like that. Does that mean, and this is something that we've seen a little bit in the fitness market, I've been able during lockdown to train at gyms in London virtually. So therefore, if my friend, I live in Brighton, I've got a friend in London who sees face to face, a great therapist just down the road from her, but she said, oh, he's great and he does virtual. Why don't you have a virtual session to him? Therefore, I might take her recommendation. He's not just down the road from me, but I can do that. Are you seeing that as an opportunity in therapy? And how is that being kind of received by the sector, this opportunity to consult somebody miles and miles away? Is that something that has been kind of explored or is of interest?
Yeah, it is, and it has. And again, it's that opportunity. It's an opportunity that's always been there. So myself, with my practice, then I've been fortunate that within the circles I operate, I've been referred to so many times from around the world. So I've done virtual worldwide for a long time. So it's something that I've spoken to so many therapists that they go, well, that can't happen for me. And suddenly now this is a real opportunity because, personally myself, within the last 2 weeks, I have seen patients in Morocco, Egypt, the US, Australia, and Germany. Just because they go, and I've always been around for these people to see me, but they just didn't realize I was around to be seen. So now they've gone, oh, hang on, I've seen something you did on YouTube or on Twitter, and I can actually have an appointment with you. Now, what that does for the industry, which I think is brilliant, is it creates an opportunity for those who want to seek opinions of certain specialists or certain individuals. It allows people to expand how they offer. But on a more basic level, I think it should give the industry a kick up the arse, because you are now under more threat in some ways, because now that stone's been lifted and the public now know I am not limited by geography of who I can see. So for those people who tick along happily, giving whatever service they want to, you should realize that a par or below par service won't cut it anymore, because these people now understand they can go anywhere and see anyone. So it's an opportunity for those who are good to be even better, and those who maybe need to improve a little bit to up their game.
Still on mute. And I guess that leads us on very, very nicely then to probably the last question. CPD had a webinar about CBD 2 days ago. It's what's on my mind. That's obviously something that has been an option now for people to do virtually. It's obviously always been an option, but like you say, you can go and have training with specialists all over the place from your living room. So that's been a big changer. But how the therapy market taken this time to upskill and to train, and what were the guidelines put out there for therapists during this time?
Yeah, so no guidelines directly. There was nothing put out as far as what you need to do or what you have to do, other than what your usual stipulated hours for the year are. Now, when we talked about the virtual appointments and the way people switch their sort of technology within their business, the difficulty for most people was understanding that tradition wasn't the only way. So traditionally, learning and continued professional learning was done by you pay money, you travel on a course, you sit in a clinic somewhere, and someone teaches you stuff. And although there are certain ways and certain aspects of our industry that is probably always going to be potentially the best way to do it, it's certainly not the only way, and it's certainly not the only effective way. So it has forced a change from the learners, but is also forced a change from the educators. Those people who would have an income and make their money from running courses have had to suddenly change tack and realize, actually, I need to pivot here and find an alternative way to do it. And in the same way technology has been available to improve your business practice and the way you offer appointments, then it's the same technology that we've used to expand our ability to learn online. The options is what is fantastic, whether you look at some free stuff that's on things like YouTube or someone's website, whether we've run Zoom calls with a number of our members where we've chatted about clinical conditions or treatment modalities, and people have just shared knowledge from that way. Recently, we saw the biggest online conference for therapists that there's ever been. 20,000 therapists turned up to watch about 100 hours of CPD, which wasn't just on a particular topic. It spanned everything that the industry has to offer. So we've seen that we can learn different ways, and we've seen that online. And I think in the same way, the virtual appointments, most therapists have realized how effective this stuff can be. Not just that it's an option, but it can really be a good option. There is a time and an expense and a commitment of leaving the family, leaving the clinic. You have to shut your clinic to normally go and learn, or you have to give up your evenings or your weekends to go and learn. Now, if someone fails to turn up for an appointment, not only might you get paid because they paid in advance and you've still got that money, but now you can suddenly click something and watch something online, or alternatively there, you can learn from the comfort and security and ease of your own surroundings. The buzzword that we've used, so it sounds like that we did this because of COVID, but in the months preceding COVID, Sports Injury Fix, we teamed up with a partner and we devised and launched a learning platform called therapistlearning.com. It just happens that we went bigger with it than we thought we would have at this stage because of lockdown. And our catchphrase for that platform, and it's something that we're really keen to push, is that it's high quality, affordable, easily accessible. And those are the three things that I would say online learning that's been put in a spotlight during COVID has shown people is the quality doesn't suffer, the access is much better, and the price point is much better. But again, going forward, there's an opportunity for people to still learn in person, learn online, learn virtually. One will be better for some than others, but they're all just options and opportunities for people.
Yeah, it's true. Because I guess the challenge with it is every man and his dog has been putting stuff out online for, so that the amount of free content that's out there is unbelievable. And as Mike said, there are some real gems in there, but equally there's a lot of it is substandard as well. Likewise, it's worth people just being a bit savvy with it as well, which is, that when people are putting out free content, that's not the crown jewels. That's just something to entice you in. So normally it's just a thin veneer of knowledge. So if you only ever you see some therapists and exercise professionals that only ever consume the thin veneer and the free stuff, which means actually your level of knowledge will only ever be that thin veneer. So actually at times it's worth paying some money for some CPD. And as Mike has said, what COVID has done is it opened up those opportunities of where that you can trust that CPD from those trusted suppliers, paying a small amount of money. It will be far less money than it would cost you to do some of the face-to-face stuff. And the amount you can learn is unbelievable. And there are platforms out there that allow you to do really in-depth things at your own pace. And there are others such as, the reason why we created ours was it's all sub 1 hour webinars that you can do in that spare hour in an evening, or if you've got a lunch hour or a patient hasn't turned up. It's those golden nuggets of learning to help complement those real in-depth courses that you may do elsewhere. And there are already some really good trusted providers of that. And there are some obviously that aren't necessarily. And a lot of that comes down to personal opinion as well.
Yeah. I think it's really interesting. One of the overriding kind of themes in the conversations we've had about opportunities and especially digitalisation is that it's something people were wanting to do, planning to do, hoping to do for a long time. And it was having that time to put it into place and also that push to put it into place. We've spoken at Elevate a lot about engaging with members at home, but no one ever did it until they couldn't physically come into the club. So I think it's similar in the therapy side. You know, it's nothing new. Zoom is nothing new, but suddenly we're all on it all the time because we couldn't be face to face. So just as a final question before we sign off, what one thing do you feel has come out of the last 4 months that has changed the sector or changed your business that you feel is kind of that golden bit, that kind of bit that you're like, that is being brilliant and that will keep going and that will really help everyone within the space?
For me, it's a simple one. It's collaboration. We, as Malcolm said, we live. Have I just stolen yours?
Yeah, the last time we did this, I stole yours, and you've done well on it as well.
Oh, you give the nod. We fought hard, and it was a losing battle sometimes when we first started to break down the echo chambers and the silos within professions. Profession to profession in the therapy world, there's sometimes a lack of communication and collaboration, but even within one profession, there are sectors that have divided and they won't communicate. We've seen an unprecedented amount of communication and collaboration where numerous professional bodies and individual therapists are trying to unite rather than divide. Our hope and ambition is that continues well beyond this now because they've seen that it's the right way to work.
Yeah, I can't add anything to that. Collaboration and communication, two things that were so needed before, have started to be put in place, and when it has been put in place, it's just super powerful, and that's at an association level, a business level, an individual level as well.